We are going to do everything that we can to end this outbreak. That is our commitment, and that's what we're going to make sure that we do that. So, as you all know, the monkeypox outbreak has evolved rapidly and uniquely from prior outbreaks. So we are in a different, it's a different dynamic than it was the last couple times, because monkeypox has been here in this country before. And so we have aggressively responded at different stages of this outbreak. And so just wanted to give you a little bit of that context because it's spreading at different phases here. First, within 2 days of the first confirmed case of monkeypox in the U.S., we began deploying vaccine to states and jurisdictions and pre-positioning tens of thousands of additional doses in a strategic national stockpile. The initial science led us to believe, and this I think will answer your question a little bit, based on recent past monkeypox outbreaks, that those doses would be sufficient to meet the needs of the country, as what we knew at that time, because it's dynamic, it's changing. And so, but however, infectious diseases are dynamic, as I just said, and unpredictable, inherently unpredictable, which is why as soon as we saw that this outbreak was different and transmitting much more rapidly, we quickly moved to order tens of thousands of more doses. So just to give you a little bit of the numbers that we have made more than 1.1 million doses available and shipped more than 600,000 doses. Those are currently out there going into jurisdictions, to states. And so, and with more being delivered each day, we also have ordered 5.5 million additional doses, which are helping us get more doses out sooner, knowing that more are on the way.
Today, declaring the U.S. a public health emergency over the nationwide monkeypox outbreak. A senior White House official confirming that to ABC News. We are told this will free up, if you like, additional resources for vaccines, treatment, and the tracking of the spread of this disease. More than 6,600 cases of monkeypox have been reported in the U.S. so far. We will have much more on this as the story develops.
It's all new at 5 o'clock.
Hi, everyone. George
Biden
Stephanopoulos
is
here.
now
Thanks
declaring monkeypox a public health emergency in the United States after more than 6,600 Americans have been infected with that virus. The CDC says more than 500 cases are now confirmed in Georgia. That's the 6th highest in the nation. So, with the federal public health emergency declaration, what does that actually do? Tonight, Evan Kozlov verifies.
We spoke with James Hodge, a health law professor from Arizona State University, Megan McGinty, an epidemic and disaster response expert from Johns Hopkins University, and we looked at information from the Administration for Strategic Preparedness and Response. A public health emergency declaration is made by the Secretary of Health and Human Services, Xavier Becerra in this case.
It would allow HHS to instantaneously do some things that it can't presently do quickly.
It enables Becerra to hire people, make grants, enter contracts, waive certain requirements, and access additional funds.
Usually during emergency declarations, like with opioids or things we've seen in the past, there actually would be a freestanding fund ready to be used for devoting to these purposes. We've been working to refill that fund post-COVID, and to my knowledge, to date, it's not yet been refilled. In fact, Congress has been reticent to do it. Now, monkeypox may change its mind very quickly, but the sheer fact is the funds that normally would be there to the tune of millions of dollars simply may not be at this point in time.
It can also allow states and local jurisdictions to purchase general supplies at reduced cost. McGinty says there's also a symbolic value.
The act of making an emergency declaration calls attention to a problem and says this is of significance that we as a country need to be paying attention to this.
With your Verify, I'm Evan Kozlov.
So as all this new information continuously comes in, we've been getting a lot of questions from you about monkeypox.
Our Karis Belger has been working to get you answers.
I've reached out to doctors and the state health department to answer 3 main questions about monkeypox.
The first question, who is eligible for the vaccine? The Centers for Disease Control and Prevention recommend the vaccine be given to people who've been in close contact with someone who's infected in the last 14 days. Anyone with a sexual partner who may have been exposed, or anyone who has had multiple sexual partners in the last 14 days in an area with reported cases. We also received questions about vaccine availability. Specifically, can you get the vaccine at a local doctor's office or pharmacy? Dr. Carlos Del Rio, a professor of medicine and epidemiology at Emory Health, explains this is not the case.
The vaccine currently is available at health departments and a few specific healthcare systems. But no, it's not available in your local drugstore, so don't go to your local CVS asking for the monkeypox vaccine because remember.
This next question is from a viewer message. He says, I wanted the vaccine for monkeypox, but no one within 60 miles has it. I live in Jefferson, which is in Jackson County, and we just have nothing available. I reached out to Governor Kemp's office and received an email that said the following: testing and vaccinations are available in all health districts. When I called the Jackson County Health Department, I was told they did not have vaccines available.
And just before we came on air, the Georgia Department of Health did send me an email saying a very limited number of vaccines are available in the Athens Health District, which includes Jefferson, and appointments are available for those who are eligible for the vaccine.
4 cities and states are declaring public health emergencies as monkeypox cases rise across the U.S. The CDC has confirmed more than 6,600 cases so far. One woman from Georgia has been documenting her battle with the virus since she was diagnosed last month, and her posts have gone viral. Camille Seaton is here with me now to tell her story. Camille, thanks so much for joining us. First of all, how are you feeling? Have you been able to go back to work yet?
Hi. I'm feeling a lot better. I am not able to go back to work yet. I did get a doctor's note saying I was able to come back as early as the 30th, but it didn't work out that way. I got a call from Human Resources, and they told me that they needed something more because of how new this virus is.
Camille,
in the process of...
Sorry to interrupt you. There's a bit of a delay. When did you first realize you had monkeypox? Were the symptoms the same symptoms you had heard you might have if you did have the virus?
I remember one night, I was just feeling so sick and like lethargic and just like, throwing up. And it was just weird because I didn't do anything to feel that way. You know, I had a good meal, the night before, and it was just, it caught me off guard.
You're a mom. The CDC says that children are at an increased risk of developing severe illness if they do get monkeypox. How's your child doing, and were you concerned, I would imagine, yes, of course, about passing the virus to your child?
My child is fine. As soon as I started seeing lesions pop up on my face, I sent her away. And with monkeypox, it's a certain stage that you reach where you become contagious. It's not just immediately after you start seeing bumps. So like, as soon as I seen and felt like something was wrong, she's been staying with family for the past almost a month.
What made you decide to document your experience with monkeypox on social media, and what has the response been like?
The response hasn't been the best. I'm not gonna lie. But the good does outweigh the bad. A lot of people are just, thankful for the information that I'm trying to give out. I just wanted to spread awareness. I just want people to know what this is, and me be living proof that you can't just get this illness from sex.
But that's a really important point, and also that anyone can get monkeypox. What are some of the biggest misconceptions about the virus, and what do you want people to know when you're speaking out?
One of the biggest misconceptions about the virus is that you can contract it sexually. Well, you can contract it sexually, but they're saying it's an STD. Like, the CDC released that you can get it through sexual contact, and everybody just took that and like ran with it. Like, that's not the only way you can get it. Like, it's a factor, but that's one of many. Droplets of people coughing, getting on you. You can get it holding hands, hugging, a simple kiss, being in the same room with someone, a car with someone who has it, touching something of someone who has it. Like, it's not only that.
Yes, as we know, also if you share bedding or, of course, skin-to-skin contact can mean many, many many, many things. Camille, we're so glad to see you looking well, and it seems like you are feeling better, and we wish you a speedy recovery.
Thank you.